hear that the DMA seed money has just been approved, and in the next 1 to 3 years, this funds are equally. So the display, the figure of this is 407, and the basic provision of funds, and like a chamber, also received the approval of 500 million. So with this development, I think the program sustainability plan, I think what has been invested here, so all the things of sustainability. That Lord, I thank you all, and I wish you a very successful celebration of this.
Thank you very much, the Minister of Health. Wonderful good news of another investment in the health sector of Kebbi State. Really appreciate his administrators around the health-friendly governor for this more investment in the health sector. We also appreciate the leadership of the Honorable Commissioner of Health in Kebbi State, because it is based on your leadership that this more commitments are coming to the health sector of Kebbi State. Thank you very much. Once again, can we please give him a round of applause? Thank you very much, Honorable Commissioner, for your leadership. So based on our agenda, the next is for us to understand the journey so far. What are the lessons? How and what happened along the road of implementation of AMPLI project in Kebbi State? To do that, may I invite Madam Endurance Bako for the presentation on from policy to practice. This is not that they take the project from what is in the document to the real practical aspect of it in the health facility, for her presentation of the journey so far of AMPLI project in Kebbi State.
All right, thank you very much. On the exit protocol, I want to welcome each and every one of us to this very important meeting. So I'll be taking us through our journey so far, the journey of AMPLI-PPHI project, how we started, and all our achievements so far. So first of all, I would like to tell us what JAPIGO is and what our goals, our visions are. So JAPIGO. All right, so JAPIGO started working in Nigeria in 1970s, and we started by strengthening the capacity of pre-service sections, programs in reproductive health in some Nigerian universities. After that, officially JAPIGO opened her office in 2006, and we started implementing several landmark projects in Nigeria. Funded by the US government, United and other funders. JAPIGO is a household name among other NGOs, Federal Ministry of Health, and it is aimed at reducing, and this project was implemented by JAPIGO in Nigeria in collaboration with Kebbi State Ministry of Health and other partners, UNFPA, Society of Gynecology and Obstetrics, SOGON, and NAM, with funding from and the European Union. So this project commenced in Kebbi State in June 2024, and we worked in 2 LGAs of the state. We worked in Argungu LGA as well as Birnin Kebbi. And we worked in 15 health facilities. In Argungu, we covered 9 health facilities, 8 PACs, and 1 general hospital. While in Birnin Kebbi, we covered 6 health facilities, 4 primary health care centers, 1 public facility, and 1 tertiary facility. So what is the goal of this AMPLI-PPHI project? Our goal is to contribute to reduce maternal morbidity and mortality by catalyzing the early adoption and readiness for scale-up of the underutilized WHO commodities. Just 3 commodities: the vaccine, which is used for prevention of postpartum hemorrhage, the calibrated rate that is used for objective measurement of blood loss, and the tranexamic acid that is used for treatment of postpartum hemorrhage. So this AMPLI-PPHI project is not only in Nigeria, it is also implemented in 6 other countries. We have the DRC, we have Guinea, we have India, Kenya, Nigeria. We have some countries by my right. Next. So the AMPLI-PPHI project is our timeline, as I said earlier, that we started in June 2024 and we are ending in July 2026. Next. So this is are the facilities that we worked in. As I said, we have 9 facilities in Arugu and 6 in Burning. These are the least engagement. There is an early protocol transition challenge because when we started, we found out that some facilities, tertiary hospitals, they were not using the HSC for cesarean section. So we saw the need to orient anesthetic doctors, anesthetic nurses, and others that are working in the theater on the importance of stable cavetocin for active management of passage of labor. And after that, we also did a clinic on postpartum hemorrhage. So these are the commodities. As I said, we have 3 commodities. The calibrated rate is for objective measurement of blood loss. The stable cavetocin is for prevention of postpartum hemorrhage, while the tranexamic acid along with oxytocin and IV fluid is used for treatment of postpartum hemorrhage. So AMPLI-PPHI project strategy. So what are the strategies that we use? The first thing that we used, as I stated earlier, was stakeholders engagement. We engage the stakeholders at the national level, state level. After that, we did our site readiness assessment. After that, we now did providers capacity building because the providers cannot work if their capacities are not built. So we had to train first of all, we started with the master trainers. We trained 16 from the state, and after which those 16 they now did step down training at the facility level using the low dose high frequency approach. And after that, we now saw the need because the calibrated rate is only domiciled in our facilities. And in Kebbi State, only 14% of women access care in the facility. So we said, if we don't do community mobilization, if we don't do demand creation, this will not work. And so we now swing to community mobilization. We have to engage key community gatekeepers. They came together, we had a population meeting, and that was where it all began. Next. So these are the strategies. I've just explained everything, the number that we train, and then, thank you. So we strengthen clinical capacity. So over 226 maternity staff were trained using the low high frequency approach. After the 16 were trained, and the master trainers were from Ministry of Health, State Primary Health Development Agency, professional associations like SOGON and NAM, and others. We also established 15 simulation sites. We call it Practice Corner. So after we have trained these service providers, we looked at it that the normal business of the day is just to train people and then you just leave them. But the AMPLI-PPHI project did not do that. After we trained them, we said, okay, let us establish a peer practice corner in each of these sites. So we were able to procure mama natali, neonatal, and other consumables that will be used for practice by their peers, by peers in each facility. So we identified the peer coordinators in each of these 15 sites, and we now established the peer practice corner in these 15 facilities. So they were practicing whenever they have management system of the state, So here we're able to train a total of 273 logisticians across our 21 LG. So this is yes. So we have a practice corner. This is a sample or an example of a practice corner. This is for FMC and this is in Sayaya. So this practice corner supports routine simulations where service providers come for periodic drills, mentorship, and also emergency preparedness. It also provides continuous hands-on practice so that their skills will be retained and it also creates a sustainability platform for our ongoing maternal health capacity building beyond our project closeout. So this, after our training, when we came back for post-training supportive supervision on skills of the healthcare providers, improved skills of them in active management of substance of labor. When we started, they had only 40.5% skills on active management of labor. But as we ended, we found out that the skills of these service providers has improved from 40.5% to 92.0%. So if you are going to any of these facilities, you should have time to work together with the WBC to strengthen them, ensure that they have their monthly meetings so that they can be able to make positive impact in their working group. In Kebbi, we were able to establish the family health department because in Kebbi they don't have family health department. So AMPLI project was able to work with for the communities. As I said, we were able to strengthen the WDC. So the WDCs on their own, they were able to mobilize resources because when we had the how can we dispose this calibrated rate. So we did we were able to brainstorm, and then somebody came during one of the meetings and he told me that almost 6 of our health facilities were able to mobilize communities themselves and build a local incinerator where the calibrated rate will be disposed. So this is how the locally fabricated incinerator is. It has a window through which the calibrated drapes are being 500 referrals. That is completed referrals, two-way referrals from the community to the facility, and feedback were gotten from the facilities. We are also able to identify 583 communities. We also did respectful maternity care across our 15 sites. We started with 5 and then we did for 11. And then we also had our 14 WBC committee revitalized. And now as I speak, they have their monthly meetings and they mobilize resources in their communities to action. So these are our key achievements and results at the community level. We're able to strengthen respectful maternity with mother-in-law as well as the Zoma Majalisa. And then we also had a breakthrough with the NURTW drivers, the keke, the motorcycle. We're able to work with them and they were able to reduce their tariff. So for instance, if you are going to Sayaya from Mori and monitoring, 2,000 women, as I said earlier, they were enlisted with referral tracking and community post survey and monthly facility review meetings. So lastly, we did advocacy and partnership, state level, communities, commitment, money expansion, and chief agents reward system was also included in what we do to sustain frontline motivation. So these are our outcome, our impact. There is increased uptake of services like our deliveries. When we started, it was 9,232, but as we are living now, we have over 12,000. So we are going to prevent or reduce parallel system. So we also have multi-stakeholders coordination. We're able to support the state to create a situation room for real-time reporting. So at the state level, at the State Ministry of Health, they have a situation room where you can see that if death is occurring anywhere in the state, you'll be able to capture the time or the statistics that you have. Next slide. So these are our major interventions and our achievements. I've stated everything. Next, please. And what are our key challenges? You know, there is no any project without challenges. So we really had some challenges, but we're able to. So the first challenge was the competence of healthcare workers. When we came, they were at 40.5%. But as we are living now, our service providers, their competency has increased from this 40.5% to 92%. While for commodities, for utilization of PPH commodities and tools, when we came in the state, they were not using, it was only FMC and SIA that had few HSC and calibrated rates. But we've been able to increase the availability and utilization of postpartum hemorrhage that since the AMPLI project started, all the women that delivered in the facilities when we started supplying those commodities had HSC giving, had calibrated rates and IV fluid to treat them. So our key contributors work together with the state to increase the use of evidence-based clinical protocol for innovative approach. We've also been able to improve availability of essential PPH commodities, enhance data use for quality improvement as well as decision making. We've increased community engagement and PPH prevention and management. We partnered with the state government to scale up our intervention from 15 health facilities to 220. And lastly, we've strengthened coordination between partners and the government. So that's RAMCA alone. It has helped us to coordinate all the activities that we have in the state. So we'll be able to reduce parallel system. Next. So our key lessons, what did we learn from this? Community engagement is key.
With this wonderful journey so far. Several key takeaways. One of the major key takeaways is the capital human resources development from 40 to 90 in terms of competency improvement. That's one of the best takeaways that I have, because when you build the capacity of personnel there, they can be able to champion it and take it from there out to the app. Can we please have a seat? Yes, please. Thank you very much. The next item on our agenda is similar to what Madam Endurance has done, but we want to hear from the state actors. We have heard in the course of the journey of implementation of AMPLI project, the Chicago will champion the advocacy for the establishment of Family Health Department. So may I invite the Director of Family Health Department for his presentation on the ENOP project based on the findings and results of implementation of AMPLI. Sir, you're highly welcome to this.
This slide. Good morning, everyone. The Honorable Commissioner, Permanent Secretary, Black and White Advisory, as well as Permanent Secretary, I have Memorial of as well as directors. They are present to start the protocol. I'm going to present key findings of this AMPLI-PPHI project throughout the duration of the project. Endurance Babu have made my presentation very easy because she virtually mentioned all that I'm about to present. Next slide, please. The research objective of this project is to assess the feasibility and acceptability of introducing heat-stable carbetocin for postpartum hemorrhage prevention, calibrated drugs for detection, as well as tranexamic acid as part of clinical care bundle for management of postpartum hemorrhage. Cross-cutting, understand the factors affecting implementation across the settings, the locations, and the levels of the health system. For the primary sources of data, please adjust the well, maybe I'll go back to the other side. It's not very clear there.
You can use this one, anyone. I use this one.
Which one? No, I can't go there.
That's it. Use this one.
Even that
No,
one.
use that one.
Okay. Data took place around September, October 2025, and the sample was around 184. For participating sites, All Amplify sites, all Amplify supported sites were involved, and participant samples were all maternity providers. We took 5 samples, while for the 24, we took about 7 samples, high frequency clinical training at home. In geographical context, Kebbi State is located in northwestern part of Nigeria and is